The other big shift, of course, is from performance management into outcomes. Outcomes are a bit of a holy grail, really, and it's the goal that many health administrations want to go for. But I think we're making really good progress on that, and I'll talk a little bit more about the outcomes framework later on. The other thing to mention is the quality standards being produced by NICE. NICE have now published their quality standard on mental health, and we're expecting the standards on the generic standards for adult care fairly soon. So a bit more on the outcomes framework. This is the framework that the Department of Health will hold the commissioning board to account with. So this is a very important strategic tool that measures how well the NHS is doing. So Domain 4 is the one that my team are particularly interested in for obvious reasons, and that's ensuring people have a positive experience of care. And from this we'll drive a number of other mechanisms to help ensure that the NHS really works through to deliver that in a cohesive way. Those other mechanisms are the commissioning outcomes framework, for example, on the far left of that slide. So that's the tools that the commissioning board will use to hold CCGs to account. So there's a sort of trickle down through the system. And commissioning guidance is what the commissioning board will issue to the NHS to try and drive that through. And then there are payment mechanisms like the tariff, like Sequin, as you probably many of you are involved with the national Sequin goals, which are linked to some questions in the inpatient survey. So that mechanism is likely to remain for, will remain for the next year at least. So a bit more on those indicators, and we've got a good range there. So a mixture of acute, but also into other services as well. So we're making a start, I think, on holding to account different types of service within the NHS. And we've got work underway to develop all of those indicators, and that's well advanced. Just a quick plug for HealthWatch. And I'm sure many of you are well up on HealthWatch and all the toing and froing about that. But the idea of HealthWatch is, at a local level, to evolve from the existing local involvement networks, links, and provide a mechanism, a forum, for people to share their views and concerns about health services and to input into local service planning and design, and to flag up concerns. And as you probably know, they've got a health and social care remit. So Local Health Watch have got some additional new powers, or will have, subject to the bill, but also there's going to be Health Watch England, which will be the national focus, and they will, so Local Health Watch will be able to feed up to National Health Watch. And Health Watch England will have particular powers to influence the commissioning board and the Secretary of State. So hopefully a new forum for strengthening patient views. And of course it's not going to be the only route by which patients can input to health services and social care, but nonetheless it's very an important one. So back on patient experience, a query as to whether it's getting any better. And in some results, in some respects, yes it is. But it's fairly slowly changing. Certainly if you look at the national surveys, the trend across the country is relatively slow moving. Between organisations there are quite wide variations. And of course I'm not going to name names. But I think there's quite a big difference in the pace of change and in how organisations differ by individual survey question. So there have been some positive improvements, for example, on those in the green box on the left, but others are being a bit more slow to move. And it seems to us that some of the transactional things that are easy to measure have been maybe subject to targets, for example, although that's not true for respect and dignity in the same way. Neither is it for confidence and trust in staff. But some of the kind of more functional hygiene factors, as some of our colleagues call them, have been easier to move, whereas some of the softer, fluffier, interrelational aspects are proving a bit harder. And those are the ones in the red box on the right. So, for example, on shared decision making, we know that shared decision making is important, and here's an interesting comparison produced by one of our analysts who's looked at a correlation between people being involved in decisions and people being satisfied. And I think that's quite marked, that where doctors are good at involving patients in decisions, satisfaction is much, much higher. And I bet a lot of doctors don't know that. We know on shared decision making that decision aids can reduce discretionary surgery, so there are some economic benefits there, but there are also obviously some patient choice and involvement benefits as well, in that patients get much more buy-in, and there's good evidence that use of decision support tools and greater level of decision making can improve satisfaction with surgery as well as specific clinical staff. So is shared decision making getting any better? Well, here's the results from the inpatient survey, and obviously this is only one factor, but it's not moving very fast, and the 2010 results, which aren't on there, are also pretty similar. So I think it shows that either the NHS isn't improving, or it's not improving as fast as patients want it to improve. So there's an expectation factor in there as well. So clearly an area where we need to go further and faster, and I think that's quite challenging for clinical staff and for frontline staff who work in a certain way and maybe need to think through some different strategies. And many patients just feel they're not encouraged to play an active role in their care, and that's a breakdown by different professions, but shows you that overall, again, there's a challenge to the system there. And as I set out earlier on, there are many reasons why we need to move on improving patients' buy-in to their and involvement in their own care, for the sake of making sure NHS resources are used where they really do need to be. But these aren't quick fixes, and we can get small measurable improvements, but I think getting more substantial change, more sustainable change, is a much longer haul. And I know many of you are very active on this and have clocked this many years ago and are working very hard with, for example, your boards, with your senior managers in your organisations to try and make this leadership and culture change fundamentally embedded in the organisation.